Every year, millions of people around the globe face the challenges of lung infections, ranging from the common but troublesome bronchitis to the more severe and often life-threatening pneumonia. According to the World Health Organization, lower respiratory infections are among the top causes of mortality worldwide, claiming nearly 9 million lives annually. Hello and welcome. Today's video is crucial for anyone who wants to stay one step ahead of their health. We're diving into 9 early warning signs that you have a lung infection. Understanding these signs is not just about safeguarding your health, it's about being informed and ready to take action at the first hint of trouble. Our lungs are vital organs, tirelessly working every second of the day to bring oxygen into our bodies and expel carbon dioxide. But what happens when they get infected? The consequences can range from mild discomfort to severe health complications that could put your life at risk. So, how can you tell if your lungs might be battling an infection? Let's go through the early warning signs you should never ignore. The first and crucial sign that you might be suffering from a lung infection is coughing with mucus. When your lungs are fighting against bacteria or viruses, producing mucus is a natural response to expel the infectants. The mucus can range in color from clear to yellow or green, each indicating different aspects of the infection. It's important to note that a persistent cough with mucus is not just a sign of a common cold, it could be evidence of a more serious condition that requires timely medical intervention. Never underestimate it, as early detection and proper treatment can prevent severe complications and protect your health. Moreover, the second early warning sign of a lung infection is stabbing chest pain. This type of pain can be particularly alarming as it often intensifies with deep breaths or coughing. It's not just discomfort, it's a sharp, piercing pain that can feel like it's penetrating through your chest with every breath you take. This symptom is a red flag because it indicates that the infection may have reached the lining of the lungs or the chest cavity, known as pleurisy or pleuritic chest pain. It's a sign that the infection is not just a superficial issue but one that's affecting the deeper structures of your respiratory system. Prompt medical attention is crucial to diagnose and address the underlying cause of this pain, ensuring it doesn't lead to more severe health problems. Furthermore, the third early warning sign of a lung infection is fever. A fever is your body's natural response to fighting off infections, signaling that your immune system is actively working to eliminate the invading pathogens. In the context of a lung infection, a fever may be accompanied by chills, sweating, and an overall feeling of weakness or fatigue. It's an indicator that the infection is systemic, affecting your entire body, not just the lungs. A persistent or high fever can be a clear indication that your body is battling a serious infection, and it underscores the importance of seeking medical evaluation and treatment. Monitoring your temperature and being aware of associated symptoms can help you recognize when it's time to consult a healthcare provider. The fourth sign indicating a potential lung infection is the presence of body aches and fatigue. These symptoms often go hand in hand with fever, but they deserve their own spotlight due to their impact on your daily life. Body aches related to lung infections can manifest as persistent, widespread discomfort, making even simple activities feel exhausting. Fatigue in this context is not just feeling tired. It's an overwhelming sense of weariness that doesn't improve with rest. This level of fatigue is a sign that your body is expending a significant amount of energy to fight the infection, highlighting the seriousness of the condition. If you're experiencing unexplained body aches and an unusual level of fatigue along with other symptoms of a lung infection, it's critical to seek medical attention to properly address the infection and prevent further complications. The fifth sign of a lung infection might seem less alarming but is equally important: a runny nose. While often associated with the common cold or allergies, A runny nose can also be an early indicator of a respiratory infection extending beyond the upper respiratory tract. When accompanied by other symptoms like coughing, fever, and body aches, a runny nose can signal that the infection has triggered a broader immune response. It's essential to monitor this symptom in the context of other signs, as it could indicate the progression from a simple cold to a more serious condition affecting the lungs. Keeping an eye on the nature of nasal discharge and whether it's accompanied by sinus pressure or headache can also provide clues about the severity and type of infection, guiding the need for medical consultation. The sixth critical early warning sign of a lung infection is shortness of breath. This symptom is particularly concerning because it indicates that your lungs are struggling to provide enough oxygen to your body. Shortness of breath can occur not only during physical activity but also in restful states, signaling that the infection may be affecting the lungs' ability to function efficiently. It's a symptom that cannot be ignored, as it reflects the direct impact of the infection on your respiratory capacity. When shortness of breath is experienced alongside symptoms like coughing, fever, and chest pain, it's a strong indicator that the lung infection is at a stage where immediate medical intervention is necessary. The seventh sign that points towards a lung infection is wheezing. Wheezing is a high-pitched whistling sound that occurs when you breathe, caused by narrowed or obstructed respiratory airways. This symptom is a clear indicator that something is not right within the air passages, possibly due to inflammation, congestion, or other blockages related to an infection. Wheezing can be particularly noticeable when exhaling and might be accompanied by other symptoms such as coughing and shortness of breath. It's a sign that the lungs are struggling to move air in and out, which can be distressing and may significantly impact your ability to breathe comfortably. If you notice wheezing, especially if you haven't experienced it before, it's crucial to seek medical attention promptly. The eighth alarming sign of a lung infection is the appearance of blue skin and lips, medically known as cyanosis. This symptom indicates a severe reduction in oxygen levels in the blood, a condition that requires immediate medical attention. Cyanosis can occur when a lung infection severely impedes the lung's ability to oxygenate the blood effectively. The bluish tint, particularly noticeable on the lips, fingertips, and under the nails, signals that vital tissues are not receiving enough oxygen, a situation that can lead to serious complications if not promptly addressed. This sign is often accompanied by other severe symptoms such as difficulty breathing, chest pain, and extreme fatigue. The presence of cyanosis in someone with a lung infection is a critical indicator of the need for urgent care to restore oxygen levels and treat the underlying infection. The ninth sign indicative of a lung infection is the presence of crackling or rattling sounds in the lungs, often heard during breathing. These sounds, medically referred to as rowels or crackles, are heard through a stethoscope when air passes through fluid-filled airways or alveoli in the lungs. This symptom suggests that there is an accumulation of fluid or mucus in the lungs, a common occurrence in conditions like pneumonia or bronchitis. Crackling sounds are a significant indication that the infection has led to inflammation and possibly obstruction within the lungs' airways, hindering effective air exchange. The presence of these sounds, especially when combined with symptoms like coughing, fever, and shortness of breath, underscores the seriousness of the lung infection. As we conclude our exploration of the 9 early warning signs that you have a lung infection, it's clear that understanding and recognizing these signs can be crucial in seeking timely medical intervention. Lung infections, if left untreated, can lead to severe health complications, making early detection and treatment paramount. We encourage everyone to pay close attention to their health and not to ignore any persistent or unusual symptoms. If you or someone you know experiences any of these warning signs, please do not hesitate to consult a healthcare professional. Remember, taking action at the right time can save lives and prevent the development of more serious conditions. Thank you for joining us on this important health journey. If you found this information helpful, please share it with friends and family to spread awareness. Don't forget to subscribe to our channel for more insightful health content and updates. Together, let's take a step forward in prioritizing our health and well-being.